Hello everybody. Today's lecture will discuss the pediatric hip ultrasound. One of the most common findings we see is the transient synovitis or the irritable hip. Usually the patient comes with limping with history of a previous upper respiratory tract infection or digestive system infection. What we find in ultrasound is simply a joint effusion, and in this history setting we can establish the diagnosis of transient synovitis, which is usually a self-limiting condition. Another common finding is the septic arthritis. Usually the diagnosis is suspected clinically. On ultrasound we can see a turbid joint effusion, or we can see increased vascularity in the surrounding soft tissue around the joint effusion. Actually, the presence of turbidity does not confirm the diagnosis of septic arthritis. Also, the absence of turbid fluid does not exclude the diagnosis of septic arthritis. So we've got to be cautious in this setting, as the diagnosis is, if suspected clinically, we should respect this point. The most common also indication for hip ultrasound in pediatric groups is the exclusion of developmental dysplasia of the hip. The most important thing is to get the view where we can measure the angles that we will discuss later. First of all, the patient should be placed in a 90 degrees flexion of the hip and 90 degrees flexion of the knee. The transducer is placed in LS plane over the iliac bone. This is the iliac bone we will see here. It should be horizontal, not inclined superiorly or inferiorly, horizontal like this. And this is the acetabular roof, this is the ischial bone, the humeral head, and the glenoid labrum. These are the structures that we have to see in our image. Here are the gluteus minimus and medius muscles, and this is the greater trochanter. First, we get a baseline which goes with the iliac bone like this. This is our baseline. The first angle we measure is the alpha angle, where it is it goes around the long axis of the acetabular roof. Normally it is more than 60 degrees. The other angle goes along the long axis with the labrum, which is the beta angle. Normally it is less than 55 degrees. Another subjective way in measurement of the our assessment of the humeral head position is that we take the normal baseline, then at the end of the acetabular roof, at this point we take a vertical line to measure the whole head of the femur. Usually about half of the head is seen inside or below the baseline, as shown in this image. Regarding the graph method types for assessment of the DDH, we have 4 types. First, type 1, where the alpha angle is more than 60 degrees, the beta angle is less than 55 degrees, and this is the mature hip. Then type 2, 2A and 2B, they have the same measurements, 50 degrees to 60 degrees in alpha angle and 55 degrees to 77 degrees in beta angle. The difference is that the age group of the patient, if less than 3 months, this is a physiologically immature hip. If it's more than 3 months, then there is delayed maturation, and this should be followed up. Regarding type C, it is from 43 degrees to 49 degrees for the alpha angle, and less than 77 degrees for the beta angle, and this is considered a severe dysplasia. Type D is a 43 degrees and 49 degrees also for the alpha angle, but the beta angle is more than 77 degrees, and this is considered an unstable hip. Type 3 is either less than 43 degrees for alpha angle and more than 77 degrees for beta angle, or maybe it's not measurable if the head is dislocated outside the socket, as we will see in some examples later. Type 4 is not measurable because the usually head is displaced totally outside the socket. This is an example. Here we can see the alpha angle is 43 degrees and the beta angle is 67 degrees. This is the alpha angle 43 and the beta angle is 67, and this goes with type 2C. This is another example where the alpha angle is 41 degrees and the beta angle is 88 degrees, and this is considered as type 3. Notice here that there is dislocation of the hip, of the femoral head outside the socket. There is a total dislocation, type 4, as we see here, out of the acetabulum. According to these measurements, the alpha angle is 55 degrees and beta angle is 71 degrees. So this is considered as type 2B. If the patient is 3 months old, so this is considered a physiological immaturity. For follow-up, if more than 3 months, this is a delayed maturation. Okay, regarding the dynamic study for DDH, we usually use the Barlow's examination and or Ortolani examination. In Barlow's examination, the hip is flexed 90 degrees, also the knees, and the patient is in an adduction position. Then we apply pressure on the hip joint. If the patient is susceptible to dislocation, we will hear a click where at this point the hip is dislocated. This can be seen by ultrasound examination on TS or LS view. On the Ortolani examination, we try to fix the dislocated hip by doing an abduction and pulling the knee joint anteriorly, where we can hear a click denoting the repositioning of the head into the acetabulum. Also, this can be seen by ultrasound. This is the Barlow's examination, abduction, 90 degrees flexion of hip and knee. We apply the pressure. Regarding the TS view, this is what we see in the CT examination. This is the metaphysis of the femur, the head and the ischium, normal side and the dislocated side. So in ultrasound, this is the metaphysis, the ischium and the humeral head, where it is seen in position during the exam. This is another example. Here we can see it in a normal position. While on applying the Barlow's test, we can see that it is displaced slightly outwards from the socket. This is the socket here. Another finding we can see by ultrasound also is the Perths disease, which is an idiopathic osteonecrosis of the femoral epiphysis in childhood. This is the normal site. We can see the normal epiphysis, and this is the metaphysis and the shaft of the femur. On the affected side, there is a fragmented epiphysis, establishing the diagnosis of Perths disease. Another finding we can see in the pediatric age group or young age group is the slipped capital femoral epiphysis. This is an example of a normal appearance of the epiphysis and its alignment with the metaphysis and the shaft of the femur. On the affected side, we can see here that there is abnormal orientation and there is some sort of slippage of the epiphysis in relation to the femoral metaphysis, with irregularity noted at the superior aspect of the metaphysis. Here is also another example. This is the normal side and this is the slipped abnormal side. Hopefully you find this lecture useful, and thank you very much.